Welcome back to another episode of HealthCap Weekly Wrap.
This week, we're diving into some powerful tools and research that are shaping how we understand and care for aging adults. We'll start with a look at a major international study exploring the global burden of young-onset dementia, a condition that's often misunderstood, but becoming increasingly relevant across care settings.
Then, we'll walk through 5 clinical tools that help senior living professionals assess and respond to common conditions among residents, from frailty and fracture risk to cognitive decline and neurodegenerative diagnoses. Whether it's the Edmonton Frail Scale or the IQCODE, each of these resources offers practical insights that can elevate care planning and early intervention.
If you're looking to sharpen your clinical awareness or simply want a deeper understanding of the evolving landscape in senior living, you're in the right place.
We're starting this week with a powerful new study published in Translational Psychiatry, part of the Nature portfolio. It takes a deep dive into the global burden of young-onset dementia. That's dementia diagnosed before the age of 65, spanning data from 1990 to 2021.
And for many senior living communities, this hits close to home. Whether it's dedicated memory care units serving younger residents or staff supporting families navigating early diagnoses, this research offers important context for the work we do every day.
The study tracked over 3 decades of data, and what they found is kind of staggering. There were over 3.9 million global cases in 2021 alone, and that number's been going up steadily.
Yeah, and it's not just the numbers. What's concerning is that most of these cases were linked to modifiable risk factors, things like smoking, high body mass index, and elevated fasting glucose.
Exactly. That really connects the dots between lifestyle, preventive health, and cognitive decline. Even though this is technically young onset, it echoes what we see in older adults too.
Totally. And when we think about families choosing senior living communities, many of them have loved ones who started experiencing symptoms earlier than expected. This kind of data helps frame the urgency for earlier screening and intervention.
Plus, from a care planning standpoint, it challenges us to look beyond just age. We need to be ready for residents who may have lived with symptoms for a long time, or have a family history that raises concerns.
And the study also highlighted a few equity gaps. In low and middle-income countries, the burden is rising fastest. That's a reminder that access to care and awareness really matter.
So the takeaway here is this: dementia isn't just an old age issue, it's a continuum. And for senior living professionals, understanding those early life risk factors can guide conversations around wellness, prevention, and education for both residents and their families.
All right, coming up, we're shifting gears to a practical screening tool that can help staff get a quick read on a resident's level of frailty. That's next.
All right, let's shift gears and talk about something practical. Medscape has a growing collection of clinical calculators and diagnostic tools, and this week we pulled together a handful that are especially relevant for senior living communities. These tools can support everything from risk assessments to early detection of complex conditions. Things like frailty, dementia subtypes, cognitive decline, and fracture risk in older women.
Now, we're not saying every team member will use these daily, but for clinicians, nurses, and care planners, they're incredibly useful for guiding conversations and identifying concerns before they escalate.
So let's walk through a few of them, starting with the Edmonton Frail Scale, a quick, structured way to assess frailty in older adults.
Yeah, this one's a really practical, structured tool for assessing frailty in older adults. It covers 10 domains. Things like cognitive function, mood, functional independence, nutrition, medication use, and even social support.
Right. What's nice is that it's not overly complicated, but it gives a pretty comprehensive snapshot of a resident's overall vulnerability. It's something that could be integrated into routine assessments or even used at admission to help tailor care plans.
Exactly. And in senior living, especially when residents are transitioning from independent living to assisted living or memory care, understanding frailty levels can really guide how we support them day to day.
The tool also includes a quick get up and go test, so there's a performance component, not just self-reporting or observation. That adds some objective insight, which is great.
And the scoring system? It ranges from not frail to severely frail. and helps staff track changes over time. It's a great way to catch decline early or even celebrate improvements when residents respond well to interventions.
Plus, it opens the door for interdisciplinary care. If someone scores high in emotional health but low in nutrition, it's a cue to bring in dietary support or maybe even connect with family.
So, for communities looking to strengthen proactive care models, the Edmonton Frail Scale is a great starting point.
Next up, we're talking about a risk calculator specifically designed for women, with a focus on bone mineral density and fracture prevention.
So let's get into that tool. This fracture risk calculator is designed for women with known bone mineral density results, and it helps estimate their 5-year risk for different types of fractures: hip, vertebral, and other major ones. It's a really practical way to turn diagnostic data into meaningful prevention strategies, especially for older women in senior living communities.
Yeah, and this one really matters in senior living. We all know how devastating a fall can be, especially if it leads to a hip fracture. Having a tool that quantifies that risk helps us move from reactive care to proactive planning, especially for older women who may already have signs of bone loss.
It takes into account factors like age, weight, history of fractures, and even family history. So it gives a pretty individualized risk profile.
What's helpful here is that it can guide both prevention and intervention. For example, if a woman scores high on fracture risk, the clinical team might look at medication options, physical therapy for strength and balance, or environmental adjustments in her living space.
And from a care planning perspective, this can really help in conversations with families. Instead of just saying, your mom is at risk of falling, you can give them actual data to support next steps.
Right, and in many communities, BMD results may already be in the chart, especially if the resident came from a hospital or has seen a specialist. This tool just helps make better use of that information.
It's also worth mentioning that while this one is for women, there are other fracture risk tools out there that include men. But this one is great for the majority of senior living populations where women often make up the largest demographic.
All right. Coming up next, we're shifting back to cognitive health with a diagnostic tool for identifying dementia with Lewy bodies.
Yeah, this is a big one. DLB is the second most common type of progressive dementia after Alzheimer's, but it's often misdiagnosed because the symptoms can overlap with other conditions like Parkinson's or general cognitive decline.
This tool, available through Medscape, walks clinicians through the official criteria from the DLB consortium. It's designed to help identify key symptoms, like cognitive fluctuations, visual hallucinations, REM sleep behavior disorder, and Parkinsonian movement features.
And the important thing here is that DLB doesn't always present the same way. A resident might seem fine one day and extremely confused the next. That fluctuation is a hallmark feature. And it's one of the reasons this tool can be so helpful.
Right. It's especially useful for senior living staff who are noticing unusual patterns in a resident's behavior. Maybe someone's cognition seems inconsistent, or they're having vivid dreams and acting them out in their sleep. Those are red flags worth exploring further.
Plus, the tool differentiates between possible and probable DLB based on how many core features are present. That can help guide whether to pursue further neurologic testing or make adjustments to care routines in the meantime.
And from a safety standpoint, recognizing DLB early is important. Some medications that work for Alzheimer's or other dementias can actually worsen symptoms in people with DLB, so getting the diagnosis right has real implications for quality of life.
So even though this isn't something that'll be used every day, it's a great resource to keep bookmarked for clinicians and nurses in memory care units or communities where unusual cognitive presentations are showing up.
Coming up, we're staying on the topic of neurodegenerative conditions, but this time with a focus on multiple system atrophy, or MSA.
Now, this one's a little less common than the other conditions we've talked about. But when it does show up, it's often confusing and really hard to pin down without the right framework.
Exactly. MSA is a progressive neurodegenerative disorder that can look a lot like Parkinson's disease at first: tremors, stiffness, movement issues, but it also involves significant autonomic dysfunction. We're talking things like severe blood pressure drops, urinary incontinence, or trouble regulating body temperature.
The Medscape tool uses the second consensus statement on the diagnosis of MSA, and it guides clinicians through the specific symptom combinations that point to a diagnosis. It helps sort out whether someone meets the criteria for possible, probable, or definite MSA.
And that kind of clarity matters. In senior living communities, especially in memory care or higher acuity settings, we sometimes see residents who aren't responding to Parkinson's medications as expected. That's often a clue that something else, like MSA, might be going on.
It's also a condition where progression tends to be faster and more severe, so early identification helps with care planning, resident and family communication, and setting realistic expectations.
Yeah, and while MSA is rare, this is the kind of tool that makes those rare diagnoses a little more approachable. Even if it's not used often, just knowing it's available gives teams one more resource in their toolbox.
All right, last up in our toolkit is a cognitive screening tool that involves input from someone who really knows the resident, like a family member or longtime caregiver. That's the IQCODE, and we'll get into that next.
So, rounding out our list today is the IQCODE, which stands for the Informant Questionnaire on Cognitive Decline in the Elderly.
This one's a little different from the others. It doesn't come from the resident directly. Instead, it's completed by someone who knows them well, like a family member or longtime caregiver.
Yeah, and that's what makes it really valuable. It looks at changes in cognitive function over time, typically across the past 10 years, and because it's based on someone's observations, it can pick up on gradual shifts that the resident might not report themselves.
It asks about everyday things, like remembering names, handling finances, navigating familiar places, and scores them based on whether the person has improved, stayed the same, or declined.
And it's useful in a lot of different settings. You can use it as a screening tool when someone first moves into the community, or even during care plan meetings to track how things are evolving.
What's great is that it works well even when the resident has limited ability to communicate clearly. If there's a history of stroke, hearing loss, or speech issues, you're still able to get a picture of their cognitive trajectory through the eyes of someone who's been with them along the way.
And it's been used internationally, so it's validated and reliable. Plus, it can be a gentle way to involve families in the assessment process, especially when they're starting to notice changes but aren't sure what to do with that concern.
So overall, it's a helpful bridge between clinical insight and real-life observation, something we rely on every day in senior living.
And really, that's the theme running through all of these tools. Whether it's assessing frailty, estimating fracture risk, or navigating complex diagnoses like DLB or MSA, each one gives us a clearer view of the resident's needs and how we can respond with care, intention, and teamwork.
These aren't just clinical checklists, they're conversation starters. They help us engage families, support frontline staff, and create care plans that are truly person-centered. And with that, we wrap up this week's podcast.
Thanks so much for spending time with us on HealthCap Weekly Wrap.
As always, you can find more details about these stories and links to the tools themselves in the weekly roundup on Angie's blog at healthcapusa.com/Angie's-blog.
We'll see you next time.